Hey everyone, this is Ben with RegisteredNurseRN.com, and in this video we're going to talk about nurse practitioner salaries. Now, nurse practitioners are those advanced practice nurses who diagnose and treat acute, chronic, and episodic illnesses. They do that independently or as a part of a healthcare team, such as in a hospital setting. Nurse practitioners may focus on health promotion and disease prevention, and they can usually order, perform, and interpret diagnostic tests such as lab work or x-rays. In fact, some of them can even prescribe medications, much like a doctor can. Now, in order to become a nurse practitioner, it's going to take, first of all, a bachelor's degree in nursing, and you're going to have your RN license. Some schools and state boards will require that you work for a couple years as an RN before you apply to a nurse practitioner program. And then you have to apply to the program, which is a master's degree program. It takes about 2 to 3 years to complete. After your bachelor's degree, you'll have to do lab work and clinicals, much like you did with your RN degree. And then finally, upon graduation, you have to sit for a state board's exam. And when you pass that state board's exam, finally you can work as a nurse practitioner. Now, if you think about it, becoming a nurse practitioner is a great compromise between an RN and a doctor. Why? Because first of all, nurse practitioners, as we're getting ready to see, earn a pretty competitive salary. Some may even earn a little more than some types of doctors. In addition, you're going to have a lot of the same skills and knowledge as an RN, but perform a lot of the same tasks as a doctor. So it's a really great compromise for some of you who are kind of on the fence about going to medical school versus being an RN. Nurse practitioner may be right up your alley. So let's talk about the income now. In 2014, according to the Bureau of Labor Statistics, the average hourly wage was $47.11 for a nurse practitioner, and the annual salary was $97,990. That's a pretty substantial salary. Now, not everyone's going to make that much. Some of the things that are going to cause a variation in income include how long you've been working, what state you work in, some of the industries you work in. So let's take a look at some of those factors. First of all, the states with the highest income. Surprisingly, Georgia had the highest average income for a nurse practitioner at $115,870. Number 2 was California at $115,460. So those were the 2 top earning states. The lowest salary came from Oklahoma at $82,880, and then second, Kansas at $84,270. So those were the 2 lowest. Now, let's talk about the industry with the highest employment levels. The highest concentration of employment levels for a nurse practitioner was, first of all, offices of physicians, and the average salary for that was $96,570. And then the second highest employment level industry was general medical and surgical hospitals at $102,330. And then finally, what is the top paying industry? The top paying industry was personal care services with an average of $118,080. And then specialty hospitals came in at number 2 at $114,410. So that gives you a little bit of information. Nurse practitioner is a wonderful career. It's an exciting career. And if you're interested in doing this, definitely check out more information on our website about it. So make sure to subscribe to this channel, and thank you so much for watching.